All right, looks like we got most everybody. Well, welcome everybody to Wednesday, and it's worth a shot. Today, Tom Vincent from Mountain Pacific will be going over quality measures, your quarterly reports, and how to review them. Can we go to the next slide, please? So as always, we have internal presenter today, but if we do have external presenters, we do want to know that that doesn't mean that we are endorsing or recommending that information. We just like to give as many sides of the story or as many takes on a subject as possible. So that's why we do bring outside presenters in. Next slide, please. All right, quite a few updates and reminders this week. So just to let you know, it is Men's Health Month for 2024. So we do have a linked website for Office of Minority Health if you want to go ahead and check that out. It is also Post-Traumatic Stress Disorder Month. So again, we have another link there as well if you want to go through some of the resources. We have the Resident and Family Guide to Understanding Sepsis, which is a Mountain Pacific resource with the link there. The Skilled Nursing Home Facility Sepsis Care Kit, which again is a resource by Mountain Pacific, and I believe that was just recently updated, but I could be wrong. And then we've got Situational Background Assessment Recommendations, so SBAR for possible sepsis. And then we also, there we go, that's the updated one. So our survey readiness book has recently just been updated, and you can find a link there. And just to let you know, when you click on these links, you will have to put in your name and email address. That's not to add you to a listserv or anything like that. We're not, tracking you to see what, you're looking at. What we are looking at is the clicks within our own website to see what resources get the most traffic. So if you'll just humor us and fill that out quickly to get your download, then we really appreciate it, because then it helps kind of guide our content and the information that we share. Next slide, please. All right, so we did want to let you know that we do have a sepsis awareness and prevention webinar that is tomorrow on the 20th. So if you haven't already, we please recommend that you sign up. You cannot register clicking the button because obviously this is a picture within a slide deck, but the link that we have there for register is open and can take register. So we please encourage you to join us for the webinar. And then next slide, please. And as always, we do welcome your ideas and recommendations for topics, or if you want to present and let us know, we always really appreciate that. And again, we do appreciate you showing up every Wednesday for us. I believe we are on the 122nd webinar since we started. So we've made quite a few Wednesdays together, guys. If you can fill out the evaluation that Mario put in the chat, we really appreciate input from our attendees, and it helps guide what we're doing. And then we have a polling question for everybody. So we'll go ahead and make that live, Mary. All right, has your facility completed a full-scale exercise for emergency preparedness? We've got yes, no, but we have a plan, and no, we would like assistance. All right, looks like we've got 41 people on the webinar. We've got about 22 responses so far. And if you do say no, we would like assistance, we will be reaching out to you. So if you want to do the evaluation and let us know that you're the one that selected that, that's great. We'd appreciate it. Or just drop an email in the chat and we can connect you that way, or we'll kind of look on the back end and see who our no is. But if you don't want to be identified, that's no problem. All right, let's go ahead and close the poll. And there's the results. Okay, we can move on to the next slide. And I'm going to hand it over to Tom to take over presentation.
All right, thank you. And thank you for joining us, everybody. Today, as the title says, we're just going to review the quality measures reports. We realize that with many nursing homes, there's quite a turnover in staffing, and some of you may not understand some of the what's included on the reports and why, where they come from, etc. So we thought this would be a good opportunity to discuss some of that. So we're going to take a look at how the report started, I'm going to switch gears a little bit and talk about some changes that are being made to some of the MDS measures that are on the report that are taking place, and they will have an effect on the data that we see on the reports. I'll call up a report live, and we'll take a little tour of the report. And at the end, I'll kind of go over some of the sources that I use to create the report. So let's get started. Next slide, please. So the current reports, as you see them, they actually started a few scopes of work ago. We had a task order, I believe it was in our 10th scope of work, where one of the tasks that we worked with our nursing homes with was on what was known then as the composite score. The composite score looked at 11 MDS measures and 2 vaccination measures. And the calculation was set up so that we could use the 13 numerators and denominators to create a composite rate. And the goal was to keep that rate below 6%. To better monitor both for our progress in the QIN, QIO, as well as letting the nursing home see how they're doing with the composite reports, we created the monthly composite score reports. These enabled the nursing homes to see, hey, maybe we're a little above that 6%. What are some of the measures that if we could really work hard and reduce the number of residents that are triggered in this measure, it would put us at that 6% or below. Next slide, please. So after that scope of work, obviously we were no longer working on the composite score, but we did have some call from the nursing homes that they liked the reports and asked that we keep distributing them, which we did. We did face some challenges as we got into other scopes of work. Data sources changed, the availability of that data changed. Even some of the tools that we used in-house to mine the data were changing on us, created quite a challenge. And we actually went through a period of time where we just couldn't distribute the reports. Obviously, we're glad to say that we were able to come up with not a monthly report, but a quarterly report. And we're currently reporting 22 measures on the report. So they continue to evolve and change. And we're happy to do them for as long as nursing homes find them valuable. Next slide, please. So I'm going to switch gears here. Currently, there are some changes to a few of the measures that are on the report. And most of you, if not all of you, I'm sure, are familiar with these changes. Section G in the MDS has been replaced with section GG, and this is the functional status section of MDS. And there's 3 measures that are on the report that are affected by this: 401, 451, and 453. As you can see, they all have to do with the function of the residents. MDS is reevaluating this. They're trying to streamline the process for MDS assessments, as well as collect more information on the measures and hopefully make them more intuitive and useful in improving the quality of care for the residents. While this is taking place, the data will be frozen for 3 quarters. It's predicted that around January 2025, the data will restart. We'll start to see data again, excuse me. This is to allow time to adjust to the new calculations and to gather more information for the public. And as you'll see when we take our little tour with in the report, we're already starting to see results of that data being frozen. Quality measure 471 has also changed. It used to be residents with improvement in function. It will change to the discharge function score, and that becomes official in October 2024. Some of you may have noticed though on the last reports, I've already changed the name. I guess I got excited that there was a change here, and I went ahead and changed that. But it becomes official in October of 2024. Now there's changes to these measures and other areas of MDS that are important. I have provided a link to one resource, but there are numerous resources out there that will explain these changes in more detail. Now, the next quality measure, 476, that's kind of an internal change. We've noticed that data wasn't coming in for 476 for the last couple of quarters. And I made a mental note to go back and research that. And as what happens with most time I make a mental note, it gets pushed aside when I continue work on something else. However, with the presentation and we got asked specifically about this data just recently, I thought this was a great opportunity to actually go out and research it. And what I found was that it looks like it's been replaced, 476 has been replaced with SO 38.02. And this will be changes in skin integrity post-acute care. The good news is that I found the replacement, and I'm doing some testing to make sure that everything looks as it should. And with the next set of reports, when they come out, you should see data for that quality measure, both backfilled and continue into the foreseeable future. So hopefully we've got that little mystery solved and can move on from it. Next slide, please. Okay, I'm going to share my screen for a few minutes, and we'll just take a look at a actual report here. And is that showing up as the quality measure report? I hope it is.
Yes, it is.
Yes,
Thank
we can
you.
see it.
Okay, so I created just kind of a generic nursing home quality measure report, trying to keep individual nursing homes data from showing it to everybody, PHI and all of that. But as you know, your facility name will show up here at the top, as will your most current 5-star rating and quality measure rating. And I try to, sometimes I wait, this is the last piece of the puzzle. I wait until the file, the source that I get this from is the most recent star report, so that when you look at the quality measures report and then look at nursing home compare, your star ratings will match. We found that early on in this, when we started adding these, that they didn't sync up, and I've been making an effort to do that, so I hope that's been successful. As we scroll down a little bit, the first chart you see on the report is a snapshot of the most recent score for each measure. So we've got all 22 measures up here. And so if we look at measure 406, we're at an 88.2. And then when we scroll down to 406 chart, the most recent score is 88.2. So they're linked up so that you can see right away where you are with this most recent data. And then, of course, as we scroll down a little bit more, we start getting into the individual charts and how the measure has gone for your home over time. Now, the aforementioned quality measures that are going through changes, I've highlighted in red for this report, and you can see that our most recent data came up zeros. So it appears that data freeze is already affecting our reports, and we'll just have to kind of follow that as time goes on. But each of the reports obviously when we look at the quality measures, we look at them by quarter. And where applicable on each report, I add the most current state and national rates for each of these measures so that you can kind of see where you're at in the big scheme of things. And we have 14 of these quality measures. We chose these because they kind of coincide with the star rating, the quality measure star rating of the homes. And one thing to keep in mind with almost all of these measures, lower rates are better. We want to see the rates go down for almost all of these. There are a few exceptions, and we will point those out as we go down, but you can see we've got each measure. Here's the 451 and 453. Again, the data freeze. We came up with zeros for the most recent data. Here's the new SNF discharge function score. As I said, I jumped the gun and already put the new name on it. Now, this is a score where higher rates are better, and I've put the arrow in the upper left-hand corner of those charts to indicate that. 476 is highlighted. This is the other measure we discussed that was missing data, but I think we've solved that. So going forward, you as long as everything checks out, you should see data in here going forward with future reports. We also added, when we were creating the reports, we added 404 and 408. And we added these because kind of at the time, COVID was going on, and we thought that these would be two measures that would be useful to monitor given all that was going on in the nursing homes with isolation and some of those other things that were being implemented to keep people healthy. So that's why those were added. Those do not affect the star rating. Then we go into the flu vaccine, pneumococcal vaccine. Obviously, we want higher rates for vaccination measures. Now, these next four measures, 521, 522, 551, and 552, these are still MDS measures, but they are claims-based measures. And they're not calculated quite the same as the regular MDS measures. These are based on actual hospital claims for Medicare beneficiaries that receive post-acute care following an inpatient stay. So the configuration is a little bit different. If you are a data person and really want to know how they compile this data and calculate it, I'll be happy to send you a link to some resources, but it is quite complex. Just a heads up. You'll notice that with these four measures, I'm only reporting the rate. The data source for these measures is different from the other quality measures, and that, quite frankly, is all I have access to is the rate. I don't have access to the numerator and denominator on these. And as with all of these measures, when these fill in, we will continue with the rolling time period where as we get new data, the time period on the left will roll off and we'll continue with the current data. We scroll down a little bit further and we have the last four measures. One, of course, is the COVID vaccinations for residents in your home. Again, this is one of those measures where we want higher rates. You can see they're reported by month. Those will roll as well. And then these last three measures are actual task order measures that Mountain Pacific is working on with CMS as part of our contract. And they relate to nursing homes, and we thought that they would be good information to add to our quality measures report. So we have the ADA hospital encounters, facility acquired infection, and 30-day readmission. Something to note with these, two of these, the ADE and the facility acquired infections, these are calculated a rate per 100,000. So a regular rate, we usually multiply by 100. We're multiplying by 100,000 on these two. The basic reason is, if you look, we have small numerators and large denominators. So if I took, for instance, if I took this, this particular rate down here in January 2023, and you can see the formulas. If I did that by 100, you'd get a rate of 0.2. And that's kind of difficult to measure. So CMS has made these, a couple of these measures, a rate per 100,000. And that, on the other side of that, though, you will notice that some of the rates, because of that, can go over 100. So that is correct. It's just the way that the measure is calculated. 30-day readmissions, however, is on it's a regular rate, if you will, and it's multiplied by 100. So that's the measures that we put on here. And then after, of course, after we compile these, we email them to each of the, what are we up to, 158 homes now? And they're emailed to each of the administrators and DONs that we have on file. And I just want to say that if you're not receiving a report, or if you have any general questions after today that come up, please contact one of the nursing home team members from Mountain Pacific that you work with. We had Jolene, Miranda, Callie, Shay, depending on what state you're in, and we'll take care of your questions. And if you're not receiving the report, we'll make sure that we update the file so that you'll get the reports emailed to you. One other thing to show on this report that's kind of, and it's one of the reasons that we do this in Excel. If you're looking at one of these measures, wondering, well, what if we had fewer residents? What would our rate look like? Feel free to go in here and just change the numerator. If we want to see what, let's say we had only 8 residents that triggered, what would that look like? And you click an 8 in there, and the formula will change it for you. So you can see how much you would drop if your numerator were different. One thing I would recommend, if you would like to, if you want to kind of mess with this, is please save a copy of the original so that you always have the original numbers that were reported. And then take your copy and you can manipulate that data a little bit and kind of get an idea of the work that's ahead of you, maybe to decrease the number of residents triggering some of these measures. So with that being said, I think I'll stop sharing and we'll go back to the slides. If we could, please. And next slide, please. So some of the data sources that are used on these reports, and there are a few. First, for the 14 MDS quality measures, the data for those come from the Nursing Home Quality Initiative via CMS, and that is sent directly to Mountain Pacific and all of the QIM QIOs. That data contains the raw numerator and denominator for 40 quality measures. Now 40 seems like a lot, but when you look at what each measure is, about 20, I think I counted 22 of those measures center around influenza and pneumococcal vaccines. So over half of them are just on the vaccinations. Again, these are quarterly, and they populate the reports quarterly rates, excuse me. There is a lag of about 1 quarter when we receive the data. For example, the most recent data on the reports was Q4 2023. We received that data, it was around mid-April 2024. So there is a data lag when it comes to that data. The 4 claims-based measure, and again, these are hospital claims data for Medicare beneficiaries receiving post-acute care after an inpatient stay. That data is available in nursing home compare data sets. And I provided a link to those data sets if you are a data person or somebody in your facility they can access that data it's all archived data and they're bundled in it's roughly 20 files every time you look at a date. So it'll be dated like 6/1/2024. You download it and there's about 20 files containing different types of data in there. Next slide, please. We're almost finished here. The COVID vaccination rates, obviously that comes from NHSN raw data that you all report on a weekly basis. I roll it up and report it by month for the reports. And the link there is for the publicly reported database. The task order measures, the 3 last measures, are claims-based data, and that again is sent to us directly from CMS. So there is no link to that data for you all. And then the state and national rates, as well as the star ratings, come from those same nursing home compared data files that you can access and take a look at. And that being said, I think that's all I have today. Next slide, please. Yeah. So if there are any questions, if we have time for questions, if we don't, or if you don't think of any for today, but think of later, please be sure and email.
Thank you, Tom. That was great. A lot of information. Did we have any questions for Tom today? I don't see anything in the chat. Does anybody want to come off mute and ask? All right, no problem. Can we go to the next slide, Mary? All right, we want to thank you again for joining us. We want to encourage you to join us next week. We'll be going over facility activities. So highly recommend that one. And again, if you can fill out the evaluation today, we'd really appreciate it. So it can help guide our work in the future. And you guys have a great rest of your day. Thank you for joining us.